Now, if anything, the need for more robust health systems on the continent has been exposed by the COVID-19 pandemic, more so in the second and third waves. So what could be the practical solution to this? Now, earlier we were joined by Professor Agnes Binagwaho, Vice Chancellor, University of Global Health Equity and co-chair Conference for Public Health in Africa.
The lessons, this is why the conference in public health in Africa is created for, is to share such a type of lesson. This Continental conference organized by CDC, by Africa CDC and the African Union will create a unique platform where African researchers, policymakers, stakeholders can share findings and lessons learned to better management of threats like the COVID-19. So there is lesson learned for each and every subsector of the health sector and each and every stakeholders working in the health sector. And for example, the pandemic has emphasized the importance of building resilient health system. This will be a big part of the Continental Conference. And if we want to be better equipped and ready to respond to future health threats, we need really, country by country, to build resilient health systems. This will be a lesson that will be shared by all stakeholders in the conference that will help to shape a new public health order in Africa, really around this issue of resilient health system, continuous learning and innovation, and more equitable. Also, one of the lessons and why the conference in public health in Africa, organized by African Union, bring all those stakeholders together is because no sector can do it alone. This is a major lesson from this pandemic. We need to work together, leaders from civil society, public sector, private sector, and with the community we all serve. And this conference will give a platform to advocate, to promote continent-wide policies and advance health equity and public health in Africa. By helping to create more collaborative network and encouraging multi-sectoral coordination, the conference can help improve solidarity and speed in responding to future threats. So COVID-19 pandemic has shown also that Africa have not to wait from solutions from other regions of the planet to provide life-saving medical tools. We will discuss in the conference how to accelerate progress toward African self-sufficiency in maintaining health security and health of its people, and ensure better preparedness while taking long-standing health emergencies such as HIV, tuberculosis, and malaria still cared for. So we need to start manufacturing what we need, because the lesson, one of the major lessons is also that we cannot count on the other part of the world to share with us what they have learned, what they have in stock. We need to have our own research and knowledge increased by ourselves with the partnership of other places, other regions of the world. But we have to be self-sufficient to be able to sustain the health security of our people.
And those are very, I think, the right things Africans should be listening to at the moment, Professor Binagwaho. But I feel like this is reactionary, especially being that now we have a pandemic like COVID-19 that has exposed our health systems or lack of health systems on the continent, especially the second and third waves. But I want us to take us a few steps back to 2001 when we came out of those Ebola crisis. There was an Abuja declaration that was made, right, where countries were supposed to commit at least 15% of their annual budgets towards the health sector. Now, only 2 countries have made that, Rwanda and South Africa, as of today. 10 years on, 20 years on, we are still talking about the same things. What's going to be different this time?
We are not talking about the same thing. Africa today is more united than ever. COVID has pulled together all countries because we all face for the same time, and we are not alone. The world is in this position. And don't believe that if African countries didn't fulfill Abuja commitment, the Western countries have fulfilled theirs. How much percentage of their GDP they were supposed to share with the developing country? None of them have made it. So Africans, stop putting the blame with the finger pointed on you. Just try to analyze why it was not done. The multiple emergency that we have faced since, and also the problem that our private sector has to emerge. Also, all the wealth who is going out from Africa to develop the high-income countries, that we don't have to develop our private sector so that we can have them developed, pay more taxes. And those taxes help to build community health and education sectors so that our government can pay the 14%. So this is my message to you, journalists, about also saying that we have proved that we don't have a health sector. Western world has proved that they don't have a health sector that works as well. Look at what happened now in Florida. Look what has happened in Italy. So putting the blame is not necessarily the best way to go. And this is my lesson through COVID. Working together to solve the problems is the way to go.
Professor Binagwaho, you've mentioned that, there is the AFCFTA. Africa is more united than ever. You've given us the reasons as to why many countries didn't meet the Abuja Declaration. Now, could you give us the reasons as to why, after this conference, countries will be able to meet the declarations that they are going to make or that they have made?
I don't say that they will be able to make that declaration. There are so many declarations that Africa have done on climate change, on environment, on so many things. I just say that Africa will be able to work better together for health security of its population. This is something else. And I don't also look, there are some countries in the west of the west of our continent that now face the ordinary pandemic threat: malaria, HIV, plus COVID, and plus Marburg. So do you want them to fulfill commitment and not do immediately where they have to put the money to save the people immediately? And when you count Abuja Declaration and the 14%, do you think that you put in the basket and the account, a new account for what the countries are putting in health science education, which is for the health sector? What they are putting in responding to threats like COVID, Ebola, HIV, TB. So I believe that the count is not necessarily fair and well done. And what I expect from this conference, it's not to go, it's to look forward. What has worked for Africa during this pandemic? What has worked is coming together. If you remember well, CDC Africa has brought together all the Ministry of Health of the continent at the beginning of the pandemic, and they have discussed together what are the best norms to respond and to be prepared to such threats. And the Ministry of Health in our continent has followed those advice. That's how you have proportionally less death and infection per population in our continent. Africa has done, we cannot say that Africa has failed the response so far. Africa may fail the next phases, because for the next phases, we need the vaccine. And what we see is because the Western world has reacted with nationalism, keeping the stock for them, with expecting have more than 1 billion doses in stock by the end of this year, at the beginning of the next year, just in case of when they all sign COVAX agreements to vaccinate 20% of the people worldwide, starting by the people at risk and the health professional and the front line. They never did it.
Professor.
That's how we have less than 2% people vaccinated in developing world. So looking at that, the major lesson Africa has taken is we need to be able to produce ourselves the life-saving tools for our people. And they have worked on that. African Union have led the way. And today we have South Africa, Egypt, who are already going to produce already vaccine. And other countries are online to prepare themselves to do so, such as Rwanda, Ghana, just to name few. So that means the continent was not passive. The continent reacts well because it's a deadly pandemic, but the number of deaths we have, except some countries like some countries, but in general for the continent, have passed through this deadly pandemic doing not so bad. And the country came together to have some common action, such as putting together, and through CDC Africa, the capacity to give PPE when there was a shortage and when African countries going by themselves to pay for PPE were even not considered by the manufacturer. And same now for vaccine. African Union through CDC have secured vaccine that they are distributing to countries. So things are ongoing, and you should highlight that also for the continent.